All right, everyone, get ready because today we are going deep into the world of cephalosporin antibiotics.
Oh, this should be good.
We've got some really fascinating material to work with today. Excerpts from a YouTube lecture by Dr. Khaled M. Hassan.
Do you know him?
Yeah, he's a clinical pharmacology expert, so
Okay, cool.
I think we're in for a really fascinating deep dive.
Yeah,
I'm excited about this one.
me too.
Um, One of the things that really stood out to me when I was looking at this is this idea that there are 5 generations of these antibiotics.
Really? Like five
That's
different
generations, yeah.
Wow.
So kind of like a family saga of antibiotics, right?
Yeah, that's really interesting. Each one like specializing, I guess, in a different type of bacteria or
Yeah, well, that's what we're going to find out.
Okay.
But before we even get into that, I think it's important to even just step back and say, what are cephalosporins? Just in case people need a little refresher.
Yeah.
So essentially, these are beta-lactam antibiotics.
Right. So that's a class of antibiotics that includes penicillins,
Oh, okay.
and they all have this like chemical structure, this beta-lactam ring that's part of their molecular makeup.
Okay.
And that's what makes them work. That's how they target bacteria. They target the cell walls of bacteria
Okay.
and prevent them from growing and multiplying.
So I can kind of like put a visual on that. It's almost like they're disrupting the construction of a building
Yes, exactly. That's a great analogy.
and making it weak
Yeah.
and prone to collapse.
Exactly. They interfere with the enzymes that bacteria need to build and maintain their cell walls.
That makes perfect sense. But one thing that I always think about when we talk about antibiotics is this whole issue of antibiotic resistance.
Oh, right. Yeah.
Like, how does that fit into this picture of cephalosporins disrupting bacterial construction?
Well, that's a great question
Yeah.
because, bacteria are very smart.
Yeah.
They're very adaptable, and they're constantly evolving.
Right.
And so over time, they can develop ways to kind of work around these antibiotics.
Like workaround.
Yes, like
Yeah.
developing resistance mechanisms.
Oh, wow.
And so understanding, like you said, understanding how they're disrupting the construction, like that mechanism, can also help us understand how resistance develops.
Oh, that's interesting. So it's almost like once we understand how they're disrupting the construction, we can then anticipate
Yeah, you can kind of predict.
how they might develop a resistance.
Yeah.
That's fascinating. Okay, so we've got this family of antibiotics, the cephalosporins,
Right.
all about disrupting bacterial construction.
Yeah,
But we've got 5 generations.
we do.
What's the story with that?
Okay. Well, so you can think about it kind of like a family tree, with each generation kind of branching out and becoming more specialized.
Oh, okay.
So the first generation cephalosporins, those were kind of the originals.
Mhm.
And they were really good at targeting gram-positive bacteria.
Okay, now,
Now, gram-positive,
I know people have heard of like gram-positive, gram-negative, but
Right,
what
exactly.
does that even mean?
so it's a way of classifying bacteria based on the structure of their cell walls.
Okay.
It's a lab test. They do, that's called a gram stain.
Okay.
And depending on how the bacteria stain, they're either called gram-positive or gram-negative.
Oh.
And so the gram-positive bacteria, they stain purple,
Purple.
and the gram-negative stain pink.
Okay. So is it just a color thing, or does that actually reflect something about how they are?
It actually reflects something about how they are,
Okay.
because the way their cell walls are structured is different.
Okay.
And that, in turn, affects how susceptible they are to different antibiotics.
Oh, so it's not just like an arbitrary name. It actually tells us something about
It tells us something about how they work.
how they work.
Yes.
Okay, interesting. So first generation is kind of our go-to for those gram-positive bacteria. What kind of things are we talking about here?
So some common examples are, staph infections,
Okay.
like Staphylococcus aureus. You can have skin infections. You can have more serious things like pneumonia, even bone infections.
Okay.
And actually, one of the first generation cephalosporins, cephazolin, is really good at penetrating bone tissue.
So when would you use that?
So they often use that to prevent infections after orthopedic surgery.
So if you're going in for a hip replacement,
Yeah.
they give you a little cephazolin to make sure
Prophylactically,
to prevent.
to prevent those bones from getting infected.
Yeah, exactly.
That's fascinating. So first generation, all about those gram-positive bacteria. What happens as we move through the generations?
Well, as we go through the generations, we start to broaden the spectrum a little bit.
Okay.
So the second generation cephalosporins, they still cover some gram-positive bacteria, but they also start to have some activity against gram-negative bacteria.
So they're becoming more versatile.
More versatile, yes.
Okay.
And then we get to the third generation, where things get really exciting.
Okay.
Because these are the cephalosporins that can cross the blood-brain barrier. Now, wait a minute. The blood-brain barrier? I know, that's a big deal.
That's a big deal.
Right. It's not easy to get through that. So how do they manage that?
Well, the blood-brain barrier is this really, protective barrier that surrounds the brain.
Right.
Keeps a lot of things out.
Yeah.
Keeps the brain safe.
Yeah.
But there are certain drugs that have the right chemical properties
Okay.
to cross that barrier.
Okay.
And some of the third-generation cephalosporins, they can do that.
And why would we want them to do that?
Well, so this is really important for treating things like meningitis,
Oh.
which is an infection of the meninges,
Right.
which are the membranes that surround the brain and spinal cord.
Yeah. So they have to be able to get in there
They have to be able to get in there.
to do their work.
Exactly.
Wow, that's incredible. So these are like the special forces of antibiotics. They can get
Yes,
past
they are. They're like the Navy SEAls.
they can get past security
Exactly.
and do their thing.
Yeah.
That's amazing. So what are some examples of these?
So a really important one is ceftriaxone.
Okay.
That's a third-generation cephalosporin
Yeah.
that is used very commonly for meningitis.
Okay.
And it's interesting, it can even be given as a single dose.
A single dose.
A single dose for gonorrhea.
Really?
Yeah. So that just shows you how potent it is.
I mean, it has to be so much better from a public health standpoint.
Oh, absolutely.
Like you don't have people having to remember to take their meds every day, you know?
Well, compliance is always an issue.
It is a huge issue.
And so if you can give a single dose
Yeah, that's amazing.
and cure the infection.
Wow. That's really impressive. So third generation, it sounds like they're pretty powerful.
They are.
Okay, but you said there were 5 generations. So what about 4 and 5?
All right. So fourth generation, we're talking about drugs like cefapime.
Okay.
And these are even broader spectrum.
What does that mean?
So that means they're active against an even wider range of bacteria.
So both gram-positive and gram-negative.
Both gram-positive and gram-negative.
Yeah.
They're really good at targeting both.
Wow. Okay, so would you use those when you don't quite know what you're dealing with?
Exactly. So they're often used empirically.
Empirically.
Meaning that the doctor suspects a bacterial infection,
Hmm.
but they don't yet know the exact cause.
Okay.
And so they'll use a broad-spectrum antibiotic like cefapime.
Kind of like a catch-all.
A catch-all, yes.
Make sure you cover all your bases.
Exactly. Until they get the culture results back from the lab.
Oh, okay.
And then they can narrow down the antibiotic if needed.
I see.
But cefapime kind of gives them a head start.
It does. It sounds like it's a good one to have in your arsenal.
It is. It is.
Okay, so that's 4.
That's 4.
What about 5?
Right. Fifth generation. Now we're talking about the heavy hitters.
Okay.
These are the cephalosporins that are specifically designed to target some of the really resistant bacteria.
Mm-hmm.
Like, for example, MRSA.
Oh, yeah. That's the one you hear about in hospitals, right?
Yes, exactly. Methicillin-resistant Staphylococcus aureus.
Right.
It's a really tough one to treat.
So these 5th generation ones, they've got what it takes to go up against MRSA.
They do. So one example is ceftaroline.
Okay.
And it's specifically designed to target MRSA.
Wow. That's really impressive.
It is. It is.
It's amazing how it's like we've just gone through a whole evolutionary history of antibiotics,
It's true.
but just focusing on cephalosporins.
Yeah. Yeah.
So we've got these 5 generations. We've got the classics. We've got the versatile ones.
Mhm.
We've got the ones that can, cross the blood-brain barrier.
Yeah.
We've got the heavy hitters.
Yeah.
But how does this all play out in a real-world medical situation? I mean, it can't be as simple as just like picking one from the family tree.
It is not.
Yeah,
No,
yeah.
it's much more complicated than that.
Okay.
And so when a doctor is choosing a cephalosporin, they have to take into account a lot of different factors.
Okay.
What type of infection is it?
Okay.
How severe is the infection? What is the patient's medical history?
Right.
Do they have any allergies?
Oh, right. Allergies. That's something we need to talk about.
We do.
Because I know, cephalosporins are related to penicillin,
They are?
and some people are allergic to penicillin.
Right.
So is that a concern here?
It is a concern, yes.
Okay.
Because there is a chance of what we call cross-reactivity,
Okay.
meaning that if someone is allergic to penicillin, they might also be allergic to a cephalosporin.
So is it like their body kind of gets confused?
The immune system
Yeah.
gets confused.
And it thinks it's the same thing.
Exactly.
Okay. But how common is that?
It's not super common.
Okay.
The estimates vary, but it's probably somewhere around 3 to 5%.
Okay, so it's a possibility.
It is a possibility, but it's
But not super high.
not a guarantee.
Right. Okay, but obviously it's something that people need to talk to their doctor about
Absolutely.
if they've got any kind of penicillin allergy.
Yeah. Any history of penicillin allergy, definitely talk to your doctor
Before taking cephalosporin?
before taking a cephalosporin.
Okay. Well, I feel like we've covered a lot of ground already.
We have.
But it feels like we've just kind of scratched the surface.
Yeah, there's a lot more to explore.
There's a lot more to explore. Okay. Well, let's take a moment to kind of digest all this amazing information about cephalosporins.
I think we need it.
We'll be right back to dive even deeper into this fascinating world.
Yeah.
Stay tuned.
Right.
Wow, I feel like we covered so much about the 5 generations of cephalosporins.
Yeah, we really went through them all.
But there is still a lot more to learn.
Absolutely.
I was just thinking about how, we talked about how these drugs are actually working in the body.
Yeah.
And it made me realize that we haven't even touched on how they are eliminated.
Oh, that's right.
Like, how do they get out of our system?
Yeah, that's a really important point because Dr. Hassan mentioned that some cephalosporins are eliminated through the kidneys while others are eliminated through the bile.
Oh, that's interesting.
Yeah.
So why does that matter?
Well, it matters because it can affect how the drug is dosed,
Uh-huh.
especially for patients who have kidney or liver problems.
Okay, that makes sense. So let's say someone has kidney issues
Right.
and they're given a cephalosporin that's eliminated through the kidneys. What happens then?
Well, if their kidneys aren't functioning properly, they might not be able to clear the drug as efficiently.
Okay.
So it can kind of build up in their system.
Oh, so it's like a traffic jam.
Exactly. Like a traffic jam in the kidneys.
Right, right.
And that can lead to potential toxicity.
Oh, wow.
So in those cases, the doctor might have to adjust the dose.
Give them a lower
dose. Yeah.
to make sure that it doesn't build up too much.
Exactly.
So it's kind of like if you're baking a cake
Yeah.
and your oven runs a little hot,
Right.
you might have to adjust the temperature.
Exactly. You got to adjust the recipe
Right, to make sure that it doesn't burn.
to make sure it comes out right.
Exactly.
Well,
Okay, so that's for the cephalosporins that are eliminated through the kidneys.
right.
What about the ones that are eliminated through the bile?
So those are processed by the liver,
Okay.
and they don't require dose adjustments for patients with kidney problems.
Oh, okay.
But they might need adjustments for patients with liver problems.
Right, because if the liver's not working properly,
Exactly.
it can't process those drugs as well.
Yeah, it can affect how the drug is metabolized and cleared from the body.
Right. It really is fascinating how interconnected all these systems are.
It is. It is.
I mean, you really can't just treat an infection in isolation.
No, you have to think about the whole person.
You have to consider all these other factors.
Absolutely.
Like their kidney function, their liver function.
Their overall health.
It's really amazing.
It is. It is. It's like a delicate ecosystem.
It is. So we've talked about the different generations of cephalosporins. We've talked about how they're used, how they're eliminated.
Mm-hmm.
But I'm curious, are there any specific cephalosporins that really stand out as having unique characteristics?
Yeah, actually, there are a few that Dr. Hassan mentioned that are pretty interesting.
Oh, cool.
For example, remember Cephalosporin, our first generation friend?
Oh, yeah, the bone specialist.
Bone specialist. Well, it's also really good at targeting skin infections.
Really?
Yeah, it's often used for cellulitis,
Oh, wow.
which is a common skin infection.
So it's kind of a multitasker even within its own generation.
It is. It is. It's a versatile one.
I like it. Okay. What else?
So then there's ceftriaxone,
Uh-huh. Our third generation superstar.
the superstar. Well, one of its really interesting characteristics is its long half-life,
Okay, hold on. Can we define half-life for people who might not be familiar with that term?
of course.
Hmm.
So the half-life of a drug is basically the time it takes for half of the drug to be eliminated from the body.
Oh,
So a longer half-life means that the drug stays in your system longer
okay.
and it provides more sustained action.
So it's like you take one dose and it keeps working for a longer period of time.
Exactly. You get more bang for your buck.
I like that. Okay, so ceftriaxone has a long half-life.
A long half-life. And not only that, it reaches high concentrations in the blood and even in the cerebrospinal fluid.
Which is important for treating meningitis.
Very important for treating meningitis.
So it's like it can really get to where it needs to go.
Exactly. It has great penetration.
It does. Okay, any other standouts?
Well, there's cefotaxime, another third-generation cephalosporin,
Okay.
and it's particularly good at targeting a really nasty bacteria called Pseudomonas aeruginosa.
Pseudomonas aeruginosa, that sounds intense.
It is. It's a really tough one to treat.
Why is that?
Well, it's known for being resistant to a lot of antibiotics.
Oh, so it's like a supervillain of the bacterial world.
It kind of is.
And cefotaxime is the superhero that can defeat it.
Exactly. It's
Yeah.
one of the few antibiotics that can effectively target Pseudomonas.
Wow, that's really impressive. So we've got cefazolin for the bones and skin, ceftriaxone for its long half-life and penetration, and cefotaxime for taking on the supervillain Pseudomonas.
You got it.
Okay, what about our fourth generation all-rounder, cefepime?
Oh, Cephalosporins. Well, one of the things that makes it so useful is that it can be given intravenously or intramuscularly.
Oh, that's convenient.
It is.
Yeah.
It gives doctors more flexibility in how they administer it.
So depending on the situation, they can choose the best route.
Exactly. Intravenously if they need it to work quickly,
Okay,
or intramuscularly if it's a less severe infection.
that makes sense. It's like having different delivery options for your package.
Yeah, you can choose express shipping or standard delivery.
Exactly. So cefepime gives us options. Any other notable characteristics?
Well, it's also really good at penetrating the tissues, which means it can effectively reach the site of infection.
Oh,
So it's not just hanging out in the bloodstream. It's actually getting to where it needs to go to fight those bacteria.
so it's like it's got a built-in GPS system.
It does. It knows exactly where to go.
Wow, this is incredible. I'm learning so much.
Me too.
It's amazing how much variety there is within this one class of antibiotics.
It is. It's a testament to the ingenuity of scientists and the power of evolution.
It really is. But speaking of evolution, it makes me think about the whole issue of antibiotic resistance,
Oh, yeah.
which we've kind of touched on, but I think it deserves its own deep dive
Definitely.
because it's such a critical issue, not just for individual patients, but for global health.
Absolutely. It's a problem that we can't afford to ignore.
So let's dive in. What do we need to know about antibiotic resistance, and why is it such a pressing concern?
Well, that's a great question, and it's one that requires a multifaceted approach. We need to understand how resistance develops, why it's such a pressing concern, and what strategies we can implement to slow down its spread.
This is getting really interesting. I can't wait to hear more about this. But first, let's give everyone a chance to process all of this amazing information. We'll be right back to tackle antibiotic resistance head on.
Sounds good.
All right, we're back and ready to tackle this big topic of antibiotic resistance.
Yeah, it's a huge one.
It is. Okay, so just to kind of set the stage,
Okay.
what exactly AU's antibiotic resistance?
Well, in the simplest terms, it's when bacteria evolve
Mhm.
and they're no longer affected by antibiotics that used to kill them.
So they develop like a resistance.
Exactly. Like
Yeah.
a shield almost.
No, it's not that our bodies are becoming resistant.
No,
It's the bacteria themselves
the bacteria themselves.
that are changing.
Right.
Okay, and I know that bacteria are like incredibly adaptable, right?
They are.
They can change and evolve really quickly.
Quickly.
So how does that happen? Like how do they actually develop this resistance?
So bacteria reproduce really quickly,
Right.
and as they reproduce, they can sometimes have these little changes in their genes,
Yeah.
these mutations,
Mutation.
and some of those mutations can make them resistant to antibiotics.
Oh, okay.
And then when those resistant bacteria survive
Mhm.
and they keep reproducing,
Right.
they pass on those resistance genes to their offspring.
So it's kind of like survival of the fittest.
Exactly. It's a perfect example of natural selection.
Wow. Okay, so we've got these bacteria that are becoming resistant to antibiotics.
Right.
But haven't we always just developed new antibiotics to stay ahead of the game?
Well, that's what we've been doing for decades.
Right.
But the problem is that the pace of resistance development is accelerating.
Oh, so it's getting faster.
It's getting faster, and it's outpacing our ability to create new drugs.
So we're kind of in a race against time?
We are.
Oh, wow. Okay, so that's pretty scary, but what can we do about it? Like, what are some things that we can do to slow down this resistance?
Well, there are several things, and it really requires a multi-pronged approach.
Okay.
So, first of all, we need to use antibiotics responsibly. And that means only taking them when they're truly necessary.
So not for like a cold.
Not for a cold, no. Antibiotics only work against bacteria.
Right.
They don't work against viruses.
Yeah, I think a lot of people don't realize that.
They don't. And so they'll go to the doctor and demand antibiotics when they have a cold. And that's just not going to help.
Right, and it could actually make things worse.
Exactly.
Yeah.
Because it can contribute to antibiotic resistance.
Right. So only take antibiotics when they're prescribed by a doctor.
Yes, for a confirmed bacterial infection.
For a bacterial infection. Okay, that's a good one. What else?
And then when you are prescribed antibiotics, it's crucial to complete the full course of treatment.
Even if you feel better.
Even if you feel better, yeah.
Okay.
Yeah,
I'll admit I've been guilty of that in the past.
I think we all have.
Like, I start feeling better and I'm like, oh, I don't need these anymore.
Yeah.
Why is that bad?
Because when you stop taking the antibiotics early, you're basically allowing some of the bacteria to survive. And those survivors are often the ones that were slightly more resistant to the antibiotic to begin with.
Oh, so they're the tough ones.
They're the tough ones, and then they reproduce.
Right.
And they pass on those resistance genes, and the cycle continues.
So it's really important to finish all the pills.
Finish all the pills, even if you feel better.
Even if you feel better. Okay, that's a really good point. What else can we do?
Another really important thing is infection prevention.
Okay.
So that includes things like washing your hands frequently.
A mom would be proud.
Your mom would be proud, yes.
Right.
Getting vaccinated
Okay.
and practicing safe food handling techniques.
So just basic hygiene
Basic hygiene, yeah.
can go a long way.
It can go a long way in preventing infections in the first place.
Right, so you don't even need the antibiotics.
Exactly.
If you can prevent the infection from happening in the first place.
Exactly. Prevention is key.
Okay, so we've got responsible use,
Yep.
infection prevention. What about developing new antibiotics? Is that still happening?
Oh, absolutely. Scientists are working very hard on that.
Okay, good.
But it's a challenging process.
It is.
It's very expensive, and it takes a long time to develop a new drug.
Yeah.
But they're exploring new approaches, looking for novel antibiotics in nature,
Oh, interesting.
modifying existing antibiotics to make them more effective,
Okay.
and even targeting bacterial virulence factors.
So there's a lot of research going on.
There's a lot of research going on, and there's hope.
That's good to hear.
Yeah.
There's hope for new solutions. Well, this has been such a fascinating deep dive into the world of cephalosporins.
I agree.
You know, we started with these 5 generations.
Yeah.
And then we looked at how they're used and how they're eliminated from the body.
Right.
And then this whole issue of antibiotic resistance.
Such an important topic.
It is.
Yeah.
What are some of the key takeaways that you would want people to remember from this conversation?
Well, I think the main thing is that antibiotics, including cephalosporins, are incredibly powerful tools,
They are.
but they need to be used responsibly.
Responsibly, yeah.
And with careful consideration.
We don't want to lose these tools.
No, we don't.
Because they can be lifesavers,
They can.
but we have to use them wisely.
Wisely, yes.
So remember, everyone, talk to your doctor.
Please.
If you think you need antibiotics, and if you are prescribed them,
Take them as directed.
finish the whole course.
The whole course.
Even if you feel better.
Even if you feel better.
All right, and wash your hands.
Yes, wash your hands.
Good old-fashioned hygiene.
It goes a long way.
Absolutely. Well, this has been an amazing deep dive. Thank you so much for joining us.
It's been a pleasure.
And thank you to our listeners for tuning in. We'll see you next time for another deep dive into the world of medicine.
See you then.